just at the top of the hour, so let's get started. So good afternoon or good morning, depending on where you are across the country. Welcome to the Pathways to Resilience Learning Network session on building a healing-centered, trauma-responsive network of care. My name is Tanya Schwartz, and I'm the co-director of Pathways to Resilience. So for those of you who might be new to us, Pathways to Resilience is a national initiative to raise awareness of the impact of adversity and trauma, the impacts it can have on the health and well-being of individuals, of families, and communities, and to promote strategies in states and communities across sectors, from social services to health, to education, to justice, and so on, to prevent and address the negative effects of trauma, to really help our youth heal and to develop strategies for coping with stress so that they can build resilience. Some quick logistics for today. The session is going to be an hour long. It's in a question and answer format. We are recording today, and the recording, along with key takeaways, will be posted on our website after the fact. We also really want to encourage participation, so feel free to use the chat, raise your hand. We will pause for questions, but we really want to hear what you all are doing in your communities that might be relevant to the session and really make this interactive. When we were preparing, our speaker said, we love talking to people, so don't be shy. Please feel free to put comments in the chat. Really encourage you to participate today. So I am so grateful that we have three amazing leaders from communities in California and Ohio today who are going to talk about key components of their networks of care and share lessons learned from their work. So today we're joined by Susan Holt, a leader with the Fresno County Department of Behavioral Health, and Artie Padilla from the Central Valley Community Foundation, who are going to discuss cross-sector partnerships that they've been developing in Fresno, California. And then we have Tristyn Ball, who is a leader from the Montgomery County Ohio Alcohol, Drug Addiction, and Mental Health Services Board, ADAMS for short. And Tristyn is going to talk about Montgomery County's work to become a healing-centered, trauma-responsive county. And thanks to those who are introducing themselves in the chat. Feel free to let us know who's on today. That would be great. So if we go to the next slide, just to frame today's conversation, I'd like to start by explaining how Pathways to Resilience thinks about some of the key concepts that we're going to talk about today, because we throw a lot of concepts out there in words. So, first of all, what is a healing-centered, trauma-responsive network of care? Since we're talking about networks of care today, we should start out with, well, what is it? And so the way that we at Pathways to Resilience think about it is we define a network of care as a group of cross-sector organizations. It can include government agencies, healthcare providers, educators, community-based organizations of all kinds that collaborate and coordinate together to really link children and families to services and supports to help them prevent, treat, and heal from the harmful consequences of trauma and toxic stress. So on the next slide, in terms of key components of a network of care, and again, we're going to really go into this today, but ideally an effective and integrated network of care has a formal, established working relationship between the various organizations. These organizations also have a shared goal of mitigating the negative effects of trauma and adversity and really developing and strengthening positive relationships and environments, and helping individuals and families navigate systems of care through a no wrong door approach. So no matter where you come into the system, you'll get connected to the services and supports that you want and need. And in an ideal system, there are mechanisms in place that enable service providers working with families to really track outcomes and stay connected and kind of ensure that ongoing support. So networks of care can include a wide range of partners, and the members of a network of care might vary across communities. But there's some key ones that we think and have found to be really important. So some potential network of care members include state and local government programs. Again, today you're going to hear from 2 county leaders. health and behavioral health providers, not just physicians, but also physician assistants, nurse practitioners, nurses, behavioral health providers, and front and back office staff who interact with individuals every day are also really important. Schools and educators, that includes teachers, principals, superintendents. It includes school nurses, school counselors. Early childhood programs like Help Me Grow as a model for creating a network of early childhood supports. There are other models like 0 to 3's Healthy Steps program, in which a child development expert joins the pediatric healthcare provider team to provide support. So lots of opportunity in the early childhood area. Social services programs, this can range from WIC to food to housing assistance, intimate partner violence, addressing that, economic support, home visiting. Tribal organizations can be a really critical partner, especially in certain parts of the country. Community-based organizations like Boys and Girls Club, faith-based organizations, and the legal justice system, including juvenile justice, probation, family courts, professionals that are trained in mediation and collaborative divorce. So these are some examples of potential network of care members. There's certainly many more out there, but these are some kind of good groups and a good place to start in communities. So if we go to the next slide, research tells us that there are evidence-based actions that we can take to prevent and treat toxic stress. And we can do this at an individual level in working directly with youth. And we can use this at a systematic level as we really build infrastructure and a community-wide response to help youth regulate their stress response. And so this allows for a much more comprehensive and coordinated approach to address trauma and toxic stress. So we have a list of some here. I do want to acknowledge at the outset that there are equity issues with some of these strategies, but that's why it's so important that we come together as communities to really identify what already exists, to continue to build the supports, and to provide them. And so these strategies include having healthy and supportive relationships, getting regular sleep, eating a balanced and nutritious diet, spending time in nature, getting regular physical activity, engaging in mindfulness practices like breathing and meditation and yoga, taking care of our health, our mental health, which may include talking to a professional, and finding purpose and meaning in life. And I really like this last one. I know it's very important to me. And finding purpose, whether it's through service or volunteer work or connecting to a faith-based community, really kind of finding a calling or purpose can be so critical. So ask everyone on this call, think about the organizations in your community, which ones are providing these strategies, which ones might you want to connect with to continue to build a more coordinated network. And then finally, we're working on a new resource at Pathways to Resilience to support you all, to support communities in building and growing their own networks of care. And so this resource is going to talk about why we need a network of care, what is a network of care, and then outline milestones for communities and organizations to really establish an effective network of care. And we hope to include some lessons learned from today's session in that as well. All right, so with that introduction to the concepts, we can take the slides down, and I'm excited to get started with our questions and answers for our speakers. And thank you everyone for putting your information in the chat. It's great to see so many people on from across the country and from lots of different organizations. So with that, we are going to jump in. So Artie, I'm going to give you the first question. Could you please introduce yourself and share what led you to create the Fresno County Trauma and Resilience Network?
Yeah, thank you, Tanya. And hello, everyone. Great to be with you. Artie Padilla. I'm with the Central Valley Community Foundation. I actually lead up another collective impact initiative called DRIVE, which is economic upward mobility, but it's closely tied to the Trauma and Resilience Network that I created back in 2017. That was something that after working in community for about 15 years, seeing the manifestations of trauma, toxic stress, and then originally reading the ACEs study and the subsequent research that came after that, I really the light bulb came on for me as to kind of why I was seeing what I was seeing. And then I started digging deeper into the whys at more of a systemic level, social level. So I just started gathering originally a small group of about 10 CBO leaders that did similar type work out in the community, and really started digging into the research, asking them what are they seeing, what's going on with their engagement in the community. This group slowly grew within a year from those original 10 individuals to us having a conference at the end of 2017 where we had about 250 people that attended that really wanted to dive into what we were learning, and share what they were learning, whether it was in workforce, in the faith community, in health and education. So that's kind of how we got launched. We are still doing our work within the community, and as we go through this conversation in the next hour, I'll probably be chiming in on some of the subsequent work that's been happening since 2017.
Great, thank you, Artie. I'm going to turn over to Susan. If you could introduce yourself and discuss how you and the Department of Behavioral Health has become involved in Fresno's network of care and working with Artie.
Thank you so much. I'm happy to do that. As the Director of Behavioral Health for about the last 18 months, I'm proud to share that we were invited to the table by Artie. I was the Deputy Director for a long time before I became the Director, and our former Director and myself, as well as many of our colleagues in the department, have been involved in various initiatives over the years. As Artie described, we have a variety of collective impact initiatives that many different sectors and community members participate in our community. And we're a very large county. Fresno County is just over 1 million people and 6,000 square miles. So it's quite the undertaking to connect sectors together on really important and impactful topics. So a number of years ago, Artie reached out to our then director and by extension myself and said, hey, we have this awesome group of folks connecting on the topic of trauma. And of course we said, absolutely, we're in, where do we go? When do we show up? How can we support? And I think it was really important for Fresno that the initiative came about organically outside of the Department of Behavioral Health. And let me tell you why. I think in clinical practice, it's easy for us to come through the lens of bias that we know trauma. Like, I'm a licensed marriage and family therapist here in California. I've studied trauma, but that doesn't make me an expert on your trauma. I'm absolutely an expert on my trauma, having been a survivor of childhood trauma, completely different type of adolescent trauma, and then again, trauma within my adult life. I know what that was like for me and how I define what that looks like and how it manifests in my life. I know clinically how to build a relationship with someone in therapy to talk about their trauma, but the value in how Artie started this network focused on trauma is that it came from community. And so what it really did is it allowed the community to start talking about trauma outside of the very tail end of it, which is the treatment of the impacts of trauma. So one of the most important things that I can say about how our department became involved is that our leadership, our executive leadership, recognized that it's more impactful for us to create a culture within our department that we can have opportunities for our team members to be deeply engaged in meaningful work and embedded in the community. So I actually have probably the smallest role for our department in the network. My job is to support our team members to be engaged in that work and bring that in. And one of the both challenges and opportunities is we have many, many committed folks in our department who want to be involved, and we have many other priorities. So bringing that information in a multi-directional way so that we can take action and be of support to the community is sort of the why behind our involvement.
That's great, Susan. Thank you so much for sharing. Tristyn, we'll turn to you. If you could introduce yourself and provide a little overview of how Montgomery, Ohio ACEs and trauma work got started?
Absolutely. Thank you. So I work for the Montgomery County Alcohol, Drug Addiction, and Mental Health Services Board. So we are a county governmental agency that oversees behavioral health, really for the county of Montgomery County. We're in Dayton, Ohio, which is one of the largest cities in Ohio. So with that said, this all started kind of randomly. I read the book, The Deepest Well, and in reading that, I was like, we're going to do that in Ohio. I didn't know how, but I knew we were going to make it happen. So it just so happened that at the same time, and I'm finishing my doctorate right now, but I had to pick a dissertation topic. And I was like, I'm really interested in this. I want to learn more. So I start diving in, learning more about ACEs screening and the Pearl screening. And the more I really looked into it, the more I'm like, this is doable. We can do this. We already do behavioral health screening in schools, really universally in our middle schools and high schools. But really, we were screening for symptoms of behavioral health issues, and we wanted to get ahead of that. So we came together, my team within Adamus as a group, to talk about where would this make sense. And at the same time, again, things just all kind of happen coincidentally. At the same time, a grant proposal came out, or a call for applications through the Office of Minority Health to look at policies that could be implemented to reduce suicide among Black youth. And so in doing that, we thought this is a really good opportunity. Let's see if the community wants to do this. So we reached out to the community, because you have to get your letters of support for that. And we were overwhelmed by how much the community wanted this. I mean, we have high turnover rates in schools among like educational staff and our social workers, just because of the amount of trauma that they're seeing. And so we kind of expected the community to be a little hesitant on this, and they weren't. So that's really how this got started. And I will say there's just like an outpouring of support, and we've been really grateful to have been awarded the grant that we wrote for and to be able to continue on with this work.
That's great. Thanks, Tristyn. I think you're about at a year actually since you got that grant, which is exciting. Great. Well, let's keep digging in. So Artie and Susan, can you tell us about what your goals were for establishing a network of care in Fresno County, and specifically why developing cross-sector relationships were so important?
Yeah, I'll start. So the cross-sector connectivity really was launched from the beginning of the network back in 2017. So we knew that really to address this, the issue systemically, holistically, we needed all sectors. So we were pretty intentional about finding folks from different organizations that represented the various sectors, in weaving them in over the first couple of years. So we leveraged those learning conferences, invited them to our monthly meetings, and making sure that they understood that they had a role to play in the bigger picture of our work. When we actually launched a network of care about 2-3 years ago, that was easy for us to form at that time because of those relationships that were built. So when we built out our network of care, it was easy to line up who the CBOs were that were going to do things at the neighborhood level, what institutions what role they needed to play, and everything in between. So I think for us, the value of thinking about holistic representation for the network, and then those month-to-month meetings that we continually have to this day, the learning conferences, the collaboration of writing grants together to get funding to do specific work, all of that stuff was really cultivating so that we could have just fruitful ongoing work at a larger scale. So when this network of care got launched, it was easy for us to put together and implement and get it rolling. And even though that original grant ended, the work's still continuing, it just looks slightly different. So Susan, how would you chime in on that?
Thanks, Artie. Just to build on what you're saying, Artie, I think for For us, it was very important to have representation in the network because of the alignment with our mission and our goals as a department, and to what our colleague Tristyn said in their community, to get upstream. In California, behavioral health departments like ours have complex braided funding, which I'm sure is not unique. I'm sure our colleagues in other states do that as well. And one of the sources of our funding requires in statute planning process. And my colleague put himself in the chat there. Ahmad is a rock star here in Fresno. He and his team lead our community planning process. And so it was a natural fit for Ahmad and his team to be heavily involved in the Trauma and Resilience Network, because that helps inform our planning of how we utilize our funding to address gaps in the system of care. And in particular, what we know from the planning process and the engagement in communities is that we have gaps in providing equity-based care and in populations who don't have access to things that are readily available in the metropolitan areas of our community, and many other gaps as well. So the opportunity for us to align our funding with what we hear from the community is the way the goals have lined up really well for us. And then I would also just like to also say a goal for us is that community voice. And our team does a really great job of getting out into the community through various different strategies, in person, online, all sorts of things. And the partnership with Artie and the network has helped us be able to lift additional voices as well.
Thank you, Susan. I'm going to go over to Tristyn, and then I'm going to incorporate the question we just got in the chat in just a minute. So Tristyn, can you talk about the goals for Montgomery County and for your network, and kind of what partnerships have been kind of key to that work?
Yeah, so in determining our initial partners, like I said, when we discussed this with the community, everyone was on board 100%. We need to do something about youth that are experiencing trauma and the aftermath of that. So we were strategic in choosing our, what we call implementation sites, who will really be doing the screening. And we wanted to look at organizations that have high levels of youth experiencing trauma, just so we can get in and really intervene as early as possible, just knowing that these youth are at higher risk for the ACE-related health conditions that exist. So we partnered with Juvenile Court, Children's Services, and our Board of Developmental Disabilities. It helps that they're all county government, and we are also county government, so partnerships were kind of easy there. And we wanted, like I said, to provide the lowest level of care as early as possible. So really looking at those screenings, seeing, what risk factors for toxic stress existed, and then really looking at where they can refer to. So generally in our field, we're all mental health referrals, right? So we wanted to look more broadly at wellness. So engaging some non-traditional partners that we generally don't engage in our work, like the food banks, the libraries, just different organizations that do great work that we don't typically think of as referral sources. And then making sure that those are successful referrals is kind of the next piece. There's lots of referrals that happen that aren't followed up on. So a big goal is to make sure that referrals are successful and that families and youth are getting their needs met.
That's great. Thank you, Tristyn. So next, I'm going to ask you all, Artie, Susan, and then Tristyn, what do you each see as key elements to a successful network of care? And how does community voice, which was just mentioned, play a role in that success? And if you could also comment on Ms. Tracy Quillen-Carney's comment about specific tips for engaging private sector in this work as part of how you think of a successful network of care, that would be great as well. So Artie, why don't we send it to you first?
Yeah, great questions in the chat. Once again, we really wanted to look at, when I launched the network of care, I was actually running another nonprofit that I had created back in 2008. that was building partnerships in neighborhoods. We kind of broke up Fresno into the elementary school neighborhoods. So I was constantly building mini partnerships and then larger partnerships. So that framed my brain to be looking at small businesses and the churches from the neighborhood level all the way to the institutions. So that mindset I just took into the network, Trauma and Resilience Network. So when I say we were reaching out to everyone, it was everyone, from the medical doctors, providers, to nurses, to resident run organizations, neighborhood watch groups, neighborhood associations. And that even goes into the thought earlier on the chat about human-centered design, is when the network got established, and it did start with institutions and CBOs, but we really wanted to make sure that the community's voice was informing the CBOs and the institutions. So that's how we really wanted to make sure that we were anchored in a human-centered design kind of format. The community's voice was constantly feeding us information. And then when we were thinking about solutions, we went back to them to get their thoughts. How does this actually live out in a culturally responsive way too, right? Not just a trauma-informed way. So there was all of that. We had, thankfully, I had the connection with the local business sector. We have a Fresno Business Council. We have a manufacturing alliance. So there are these networks that I was already in that helped me build that connectivity, and all the way to small businesses and neighborhoods. And then, so a lot of our work was neighborhood based, very place based, with a lot of our CBOs and community development corporations. They started infusing more trauma-informed asset-based community development, which means you ingrain all of the assets in a neighborhood. So that, thankfully, I brought that mindset onto the network when we launched. So that got us at to a head start with making sure that we got to a point after about year 3 that we were pretty well represented within our network.
Great, thanks. Susan, do you want to comment on key elements of a successful network?
Well, it's hard to go after Artie. He said it all so well for Fresno. What I'll do to build on what Artie said is to say one of the ways that we have been able to be successful with the networks that Artie and others have built is to request help when we know that there's others who are connected in different ways to community than a governmental institution can be or is. And so with the human-centered design partnership with Artie and others, we've been able to have facilitated feedback for communities that we know are unserved or underserved or inappropriately served here in Fresno County. Most recently, we had a monolingual Spanish-speaking feedback session to help us with a needs assessment that was really centered around that human-centered design. So it's really leveraging the experts within the community. And I think an important lens that I need to try to look through, maybe I don't always succeed in that, but I try to look through the lens of letting go of ego, letting go of how we've done things in the past, and really approach things through an opportunity to see things with fresh perspectives, and making sure that we're listening and seeing everything that's around us, including leveraging the experts within the community who can help us do that better. I'll leave it with that. Thanks for the opportunity.
Thank you, Susan. Tristyn?
Yeah, I can say that the biggest key elements for us are community readiness and community participation. In regards to community readiness, we wanted to ensure that the individuals that are at the table don't feel like they're forced, that they actually want to be there. And that's really helped us scale up accordingly. We just last week hosted a community summit. It was our Cultivating Resilience Summit, to bring the community together to just discuss what we're doing. We've been doing this for, as Tanya had mentioned, about a year now, and we felt like it was the appropriate time to get other organizations involved now that we've set a really solid foundation and framework for the work that we're doing. And then the other piece around community participation, much to Susan's point, we're doing a lot around community assessments and making sure that we're doing focus groups and surveys. But the other piece of it is partnering with our after school programs to develop a youth advisory board, and then doing some training, like really a policy academy for youth to understand how to advance their equity issues, as well as advocating for themselves in a way that can actually change policy. So we're going to be starting that within the next couple of months. Actually, that's coming up really fast. And we're really excited about that because we're going to get a very different perspective from, those that are serving youth in the community to actually hearing what youth concerns are, and then really supporting them in developing their own policies to advance this work forward.
That's great. And just to follow up from the question in the chat about best practices for communication so that everyone in the network is in the loop, they know what services are available, what's being provided. And Artie, I know you put your website in, which is great. And Artie, I think you also mentioned meeting monthly with your network. Tristyn, is there anything you want to add about communication and how you're bringing partners in on a regular basis?
Yeah, so we also meet monthly with, it's the Protect Advisory Board promoting, actually, I can't even think of it right now, something around eradicating childhood trauma, but promoting resiliency over time to eradicate childhood trauma. A lot on the spot there. But we brought the group together, really looking at all different sectors of the community, and have encouraged them to spread this more widely across the community. With that said, we do meet monthly. We send out all kinds of information, probably too much information, because we want individuals to know. But the next piece of that was that summit, because we want community members and those organizations that haven't necessarily been involved to get involved. Obviously, you don't have to host a summit. You can have a town hall meeting, you could have, some kind of workshop or training to just build awareness of it. And then the hope is that, they'll tell their friends. I've already gotten a ton of feedback. So I would say that's probably best protocol just in terms of spreading the word.
That's great. And I know, Tristyn, in Montgomery County, there's been so much interest that you're now thinking about, well, how do we regularly talk to all these people, right, as we grow and grow? Which is so important. Artie and Susan, did you want to add anything? I just went to the website, Artie, that you put up.
Yeah, that's a first draft of something that actually the Urban Institute's been helping me with. But it's a tool that, like, even a resident can use, because it shows connectivity by neighborhood or by rural town, who's doing what. So we'll keep building this out. This represents only about 55 CBOs that filled out the survey, so we can enter the information. But we have been using our monthly meetings to let folks update what special events or what services are providing. We send those out in emails as well, every month after post every meeting. So there's a lot of communication. There's another platform in Fresno, and I helped create it, but it's not really a platform for the Trauma and Resilience Network, but it started with COVID, and we created the CBO calls to just keep people updated because of COVID, but those have continued to provide on-ramps to learnings and updates of who's doing what in specialty areas in the community. So there's multiple platforms that you can use here in Fresno to get kind of updated on services.
That's great. Susan, anything to add, or should we move on?
Artie said it very well, and Tristyn also. I think just one more last thing to add is the cross-pollinating of communication. So just like Artie said, the one large network that was formed to address COVID information, you're able to kind of help folks connect dots and say, hey, did you know about this network? And so we really work hard to do that across sectors. So when you peel away all of the systems, I think at the end of the day, it's relationships. And so making sure to stay mindful of who might benefit or what organization might benefit from connection to the network. And so some of it is formal and structured, and some of it is just, hey, I know someone you should meet.
Absolutely. Relationships are so critical. So Susan, I'm going to let you go first on this one. So can you talk about how you've been able to incorporate healing and trauma responsive principles into your networks, or, policies, programs, right? How are you really incorporating that across?
So that's a great question, and it's a work in progress. I often say we're better than we were yesterday, but not as great as we're going to be tomorrow. For us, taking the concept of being trauma informed and trauma responsive from idea to meaningful practice has really been a journey. When I was in the role of deputy director, it was really important to me to start putting things into policy. And yet I also knew that to have meaningful policies, it often isn't something that I should declare, right? Like if Susan says, henceforth from now on, ye all will be trauma informed, that's going to land, like a flat balloon. So what we did instead was we found our champions who were really passionate. And this is going back to probably 2016. We found some champions who were really, really passionate about making sure that everything we did was aligned with trauma responsivity, equity, person-centered care. And I charged them with having an inclusive process to create our guiding principles of care delivery. And it was really, really important to me that those were not just about clinical care. And so it was important that everyone who works within the Department of Behavioral Health and our network of care understand our guiding principles, which include more than trauma responsivity, but trauma informed and trauma responsivity is one of the 11 principles that were ultimately developed. So we created a process for input from our team members and ultimately came up with an endorsed list of 11 guiding principles. Then we embedded that into contracts. And so all of our contractor providers are expected to align their work. And then we've modified them as needed over time, and we did ultimately place them as a department policy. So the guiding principles are a policy. And then what we try to do to keep it fresh so that it's not just a policy that sits somewhere on a, an electronic binder, if you will, on a shelf, we try to have fun activities. In May, a couple of years now, we've done a guiding principles in action campaign for recognition, where anyone within the department can nominate a colleague, any colleague, from a clinician to our janitorial support teams, to our clerical team, our finance team, anyone, and nominate them for recognition for demonstrating a guiding principle in action. We generate really nice high quality certificates for everyone who's nominated, and then I put everyone's name who's nominated in a bucket, and I draw a name. I buy them gift cards. No government funds utilized. It's my unique little tiny way to give them appreciation. So we do a drawing. So that's how we've taken from idea to concept. But we do have a long way to go. I'll stop there.
Definitely a journey. Artie, do you want to add anything?
Well, I was just in a community meeting last night. We were talking about healing components, and on a planning call this morning, where we're going to be doing a presentation with 1,000 educators next month with some of my leads from the network. So, there's healing and self-compassion, self-care. All of these are kind of interconnected within our work, and it all goes. And I think I'm going to focus on what that means in the community for our residents, for our kids, right? Teaching them healing components, some self-care, and I think both of my colleagues here, Tristyn and Susan, talked about some of that work, and I think even you mentioned that in the opening slides, Tanya, was some of those areas where we all need to be thinking about how to take care of ourselves, right? Because first it starts with us. How do we take care of ourselves? then how do we take care of those around us, like our families and our networks and our friends? But then what does that mean in our workplace? What does that mean in our neighborhoods? So, there's so many layers to this onion. You got to keep peeling it, and then really figure it. And then you got to add that, like, every neighborhood's different too. We have 97, 98 different languages spoken in Fresno, so that's a lot of different cultures, right? And they all have their own ways of healing. They're all their own ways of self-care, things like that. So those are just factors, but you don't know this stuff unless you're connected, right? Otherwise you're making assumptions on services. So it's going back to that human-centered kind of thinking is you got to hear from them. They have the solutions to most of their issues, right? You've got to extract that and then come alongside them with not only, healing and self-care, but supportive services in other areas too. So I'll stop there.
Great, thank you. Tristyn, do you want to talk at all about how you've incorporated healing and trauma responsive principles into your work?
Yeah, well, a lot of that has come from a wonderful partnership with Tanya and her team. But I'll focus more on like the procedures. I think Susan already talked a lot about policy and, we're definitely doing some of that. But in terms of the actual procedures within our organizations, the Board of Developmental Disabilities, Juvenile Court, and Children's Services, we've changed the way that they're screening. And so we've been able to implement the Pearls tool in some ways, some of it is Pearls Light, into the way that they're screening and looking for risk factors around toxic stress. And then we're actually changing the way that they're doing care plans or case plans or whatever their organization calls it, to really a baseline look at those risk factors. And so we're excited to see how that really transpires, because that's something that hasn't been done previously, and really shifting, especially with juvenile court, which I will say, I think our juvenile court's done a really wonderful job even previous to this opportunity, but shifting it more from being punitive to more so looking at where are those areas for resilience, where are the strengths in the communities, what can we capitalize on? And then kind of going to the staff component is we are working with our local YMCA as well as other organizations to do some mindfulness practice and yoga actually within juvenile court and some of the other implementation sites. It's a little non-traditional for those that we're partnering with, but we're really excited and the feedback has been phenomenal. So it's going really well so far.
That's really exciting. Thanks, Tristyn. So let's see, moving on to the next one. Lots of good questions have come in both now and in advance. So I'm going back and forth here, but let's talk about challenges, right? We know this is hard. We know there are a lot of folks involved. We know it's a lot of work to make this happen. So if you could talk about what challenges you've encountered, what strategies you've used to overcome them, any lessons learned you want to make sure to share with this audience. And I'll start with Tristyn and then go to Artie and Susan.
Our challenge is probably an unusual one. It's going to sound like we're doing really great, and we are in most regards, but it got way too big, way too fast. So our network of care, people learned about it. Everyone wants referrals, and we had to kind of scale it. And for a minute had to tell organizations, hey, we're not looking for new organizations right now, just because they were all part of our advisory council that was meeting monthly. And generally from month to month, we'll have 30 to 50 members there at a time, which can become unmanageable. So what we're looking at doing moving forward is we're creating a coalition structure around this and having work groups, because the individuals that were coming to the table, the topics discussed weren't necessarily pertinent to their work. And we want to make sure if they're taking time out of their day, many of which are in leadership roles, that we're utilizing their time in a manner that's appropriate and useful for them. We want them to get something out of this as well. So we are going to really break out our advisory council and create these new work groups. And then another, I don't know that I would call it a challenge, but a lesson learned would have been involving youth earlier. We're really talking about youth, and I just wish if I could do it all again, I would have involved youth earlier. We're obviously creating our youth advisory group moving forward. But if I could give any tips, that would be it.
Thanks, Tristyn. Artie, any challenges, lessons learned?
Yeah, I resonate with Tristyn's getting youth involved early. We didn't do that. I would have gotten even like resident voice involved even sooner. It took us about a year to get that rolling, but yeah. Well, for us, it's, there's CBO capacities that we have to deal with, right? And so we have a ton of CBOs, but some of them just need a lot of capacity building on community engagement strategies, on trainings like asset-based community development or trauma-informed learnings, things like that. So those are just across the board challenges in any of the initiatives that I'm a part of is capacity building for nonprofits. There's always challenges. Now, Susan's here because she's an institutional leader that gets it, right? She sees the bigger picture of things. So, which is why we appreciate her so much in Fresno. But that's not always the case for institutional leaders, right? Sometimes you really, it's like pulling teeth to get them to meet with you first, right? To hear about the role that they can play. So, and then, I was chatting with, I think it was Christina in the chat, getting city government to be involved in these conversations too, right? So sometimes the challenges are different from both ends, the CBOs, the small CBOs to the large institutions. But I think you can overcome those with the continual relationship building that you do over time. And then using the tools like there's and Sarah, if you want to put this in the chat, this community engagement spectrum that we've been teaching our nonprofits on how to go from general outreach to more of building community power and voice, right? And then the steps to go along that. So those are some of the challenges that I'll mention.
Thanks, Artie. And it's exciting. We have lots of county and state leaders on these sessions, including today. So exciting that we have both community and we have state and local government joining these. I think there's a lot of opportunity here. Susan, any other challenges you want to mention?
Just quickly to add in, I think as a larger institution, I think it's important that we don't fall victim to initiative fatigue. We have a lot of initiatives. We're you mentioned Help Me Grow earlier in the introduction. We have a children's movement, we have the Trauma and Resilience Network, and many other very, very important cross-sector initiatives. And so it's important to see and respect and value how they're unique and distinct and how we need to be included and have a seat at the table, and also how they overlap so that we're respectful and mindful of the time of our community members, as well as the CBOs, as my colleague mentioned. The capacity within our CBOs is a challenge, right? There's limited funding and their time is very precious, and we ask them to come to a lot of things. And so it's about really being mindful of that. And then the second challenge, I think, is integrating information. I think that even within our own department, I think probably everybody in our leadership team would agree that bringing information and integrating it across our entire, even just within our department, much less our network of care, is an opportunity. Those are the two biggest challenges I think that I've experienced.
Thanks, Susan. And we received a question in advance about workforce shortages, and we know that that's a challenge for all of us right now. But Susan, anything you want to talk about how workforce shortages have impacted your work? Kind of how do you address this? And we know it's not easy, but thought that was a good question since it's something a lot of us are thinking about.
It's a great question. I don't think there's a single industry that has an adequate workforce right now. Behavioral health, we're not alone in that. I think what we've appreciated about the challenges in the behavioral health workforce specifically is that the need didn't go away. for behavioral health services. In fact, coming on the heels of the pandemic, we know the need has grown and our workforce has shrunk. So how do you do more with less? Well, it means we have to be innovative. So we have to think outside of our boxes and really listen carefully and respectfully to folks who are doing the work day in and day out. We are looking also, again, my colleague Ahmad is on the call. He's really leading our efforts in diversity, equity, and inclusion. So looking at community defined practices, which might be non-traditional, which still is an impact from a workforce lens, but that impact might be different than traditional services. So that's, I think, very important, is to think differently. It's also really important to me, and I think my colleagues across the nation on the call would probably appreciate the value of transparency. You know, we're very transparent about the workforce challenges, but we also are mindful of what that can sound like. So being transparent is valuable, but we also need to be mindful that we don't incite alarm or panic, because services are accessible and we do still have services. And so it's a careful, delicate balance to make sure that we're acknowledging where we might have fewer mental health clinicians, for example, and what we're doing about it is also important to be transparent, which leads me very quickly to the third point, which is we need to think differently about recruitment as well. You know, especially in a I can speak from a governmental institution perspective, some of the practices by which we do recruitments are outside of my authority. So it's really advocating for different ways of thinking. One of the things our department did have control on is including an equity statement in our recruitment notices. That was really important to us. But then also getting out into the community for job fairs, and then trying to encourage our county's practices to include on-the-spot interviews, hiring folks with fewer barriers. So those are some of the things that we're looking at. And then the last point I would say, in a workforce crisis, we have to be talking about burnout, because again, the workloads are high, the workloads aren't decreasing. So we've got to do what we can to be talking about how do we take care of ourselves and keep our own wellness in the forefront, because if we're not well, we won't do a great job taking care of others.
Absolutely, Susan. Thank you for saying that. That is so important. And the work that we all do is not easy. It's hard, right? And so we need to make sure we're taking care of our own staff, of ourselves, our teams, before we can help others as well. So time is going fast. We have so many questions. We can't get them to all of them. So I want to ask maybe quickly about sustainability, because that is so important. So how do you sustain your network going forward? How do you think about expanding it? Like, how do you make this last? Who wants to jump in first? Artie, Tristyn?
I can jump in real quick. In terms of sustainability, this initiative benefits everyone, right? So organizations that are dealing with people that need referrals finally have the resources and know where to go. There's so many resources. I'm sure, you know, my colleagues experience this in Fresno. I hear about new things that exist in Dayton every day that I didn't know of previously. There's just so many wonderful resources. So it's mutually beneficial for agencies that, you know, get paid for the individuals that they served, as well as those that are working with individuals that need to be served. With that said, though, we're trying to move everything online. So we actually have an app, Local Help Now, that we are redesigning to really promote more wellness initiatives, as well as the treatment initiatives that we've typically had. So this will live online and be a resource long after, you know, we're gone, that, you know, individuals and organizations know where to go and they can find what they need, regardless of if we have funding or if we, to Susan's point, if we're even still employed at the same organizations. So we're really excited about that and think that that will really play into the result or the sustainability of this.
Yeah, so quickly, we similar. We have micro work that happens, and usually a lot of that gets cropped up because there's funding available, partnerships are created that go after a grant. Then we always want them to try to think about sustainable funding, right? So we're always looking at that. Now, I'm a funder now. I work for the foundation, so I can play a role in that. So, but I also work with some of my statewide funding partners and there's a big movement here in California, so it's not hard to sell that. I'll share this quick story. At one of our conferences, we were highlighting the business sector, the workforce sector, because we were intentional about inviting the employers, the CEOs. One of them went to this, heard all this information. She heard the value of trauma-informed work for her employees. She sat down, met with me. She said, never heard this stuff before. I want to help. She wrote me a $35,000 check right there. This is to support this work, right? That's one person, right? Getting the word out, and you have to, business owners, it's all about like a bottom line, right? But when they realize that trauma impacts productivity at work, if they increase their productivity, that's going to increase their bottom line. You got to make those connections. So, that's just a quick story on sustainability.
Thanks, Artie. Susan, anything you'd like to add?
I think just to add, for sustainability, it's really important to have mindful transition plan. If Artie wins, some, big Powerball or something. I don't even know if you play Artie, but if something awesome happens to Artie and he moves to another state, we've got to be thinking about how do we carry the work on when the biggest champions go another direction. I think that's also really important for adding structure to processes that are very organic. So writing things down. Making sure that we're talking about what does the future hold for the work that we're doing. And then again, that inclusive approach so that, we're more, what's that, the quote, I'm not going to remember the quote properly or who to credit for the quote, but, when we are all lifting a little bit, it's easier to lift. So we can't have one person holding all of that. So those are things I think of a lot about sustainability for these cross-sector partnerships.
Thank you, Susan. So important. And also people retire at some point, right? So thinking about those, so maybe never. All right, so we have 2 minutes left. So we really like to end these sessions with action items that people can take back to their communities. Can you please each just briefly share kind of 2 or 3 actionable steps that our audience members can take to build or sustain their own networks of care? So Susan, let's go to you first.
I would say the first actionable thing you can do is next time you're with whatever your team is, whenever you're with your people, tell them, hey, I participated in this webinar and this is what I learned. What should we do? Find your champion and start with an action locally. Don't hoard this information. Start out by having a conversation. Where are we now and where do we think we want to go and what would that look like?
Thank you, Susan. Tristyn.
Yeah, start having these conversations, start gauging whether or not, the community is ready for this. If you can find the champions, engaging non-traditional partners that see these issues every day, your libraries, your juvenile court, your all kinds of different organizations. And then start looking at referral pathways. Where are the barriers in your community and how can you maybe facilitate connections that weren't there previously? I would say are my 2 starting points.
That's great. And Artie.
I'll just stick with if you're on the front end of creating some type of movement, build relationships and keep them strong, keep them healthy. Be intentional about reaching out to multi-sectors and know that that takes time and it's ongoing, it never ends. But the time that you spend into it pays off tenfold over time. So, don't be discouraged if the work is hard at the front end, it pays off.
Great. Well, Artie, Tristyn, Susan, thank you all so much for being here today and sharing your incredible work and your lessons learned. I want to thank everyone for joining. We had people stay on to the very end. We really hope that this will inspire you to go back and continue to build networks of care in your communities. Please feel free to reach out to us at Pathways if you'd like any support in this journey. The recording of this session and key takeaways will be on our website. We'll send out an email about that. And we hope that you'll register for our next Learning Network session, which is going to be on September 12th. And this session is going to be on to screen or not to screen and how we can identify exposure to adversity in order to promote healing. And we're going to have some great state representatives as well as someone from the Indian Health Board. So we hope that you will join for that session. So thank you, everyone. I hope you have a great rest of your day. Take care.